Hi, people. Welcome to today's edition of Tales of a New Moon. Today we'll be talking about treatment in sickle cell. Lest I forget, my voice is back. Hooray! Treatment for sickle cell disease is actually aimed at three major things. Firstly, is avoiding crisis. Secondly, is relieving symptoms, and thirdly, preventing complications. There is no single best treatment for all people with sickle cell disease. Treatment options are different for each person depending on the symptoms. I'll just take some of the symptoms. But then we should remember that the symptoms I mentioned here are not, that those are not all the symptoms. I mean, we have lots and lots of symptoms, so I'm just going to be mentioning a few. Symptoms like anemia, like frequent infections, like vision problems, abdominal swelling, shortness of breath, problem walking, problem talking, fatigue, dizziness. We have inflamed fingers and toes, mostly in children. We have yellowing of eyes, the white part of the eyes, the sclera, becomes tinted with yellow, and then we have pale skin. Um, you know, it goes on and on and on. Uh, so, um, so depending on the symptoms I've mentioned, um, you know, that is when medical practitioners actually will know, or you will know which treatment options is the best for you. So we have treatments like receiving blood transfusions. Uh, there's receiving intravenous therapy. That's a fluid given into the vein. Also, there are medications that helps with the pain. In severe SCD, there is a medication called hydroxyurea. According to research, hydroxyurea can reduce number of painful episodes in sickle cell disease. To reduce hospital stays and the need for blood transfusion, even in adults. Uh, Okay, let me talk about avoiding crisis. Now, I'm going to be mentioning some tips. We should know that causes for crisis are not limited to one single cause. It could be as a result of lots of things combined together. So you could actually help in preventing your own crisis. You could take precautions. And firstly, I would like to say that keeping a positive attitude is very important. You have to keep positive all the time. You don't be negative about yourself, because um, it will go well in the way you see yourself and the way other people sees you. Let's continue with tips in avoiding crisis. Firstly, don't smoke. If you're already smoking, it's time to quit. Yes, quit smoking. And then reduce your intake of alcohol. If possible, don't take alcohol. Uh, Also, keep warm. Keep warm. Make sure uh, you wear clothes that could help you during cold weather. And if there's air conditioned in the room, you might want to keep yourself warm as well. Also, don't swim in cold water. Yes. Má lúwẹ̀ẹ́ nínú omi tútù. Yeah, simple as that. If you must swim, make sure it's a warm water. You might actually help yourself by doing that. Also, if you have any infection, I think you should treat it as soon as possible. See your doctor. Also, if you have problems sleeping, you might want to visit your doctor um, as regards that. Also, if you're pregnant, yeah, if you're pregnant, you want to start your prenatal care as early as possible. uh, Let your medical practitioners be aware uh, about your condition. And then most importantly, keep hydrated, drink water, drink fluids, exercise your body. Don't exercise too much, that will totally get your body all tired. But take adequate exercise, and when you exercise, make sure you take enough fluid. Yeah, that will help. Hydrate your body. Drink water every day. Drink about 8 to 10, 12 ounces glasses of water every day. I think these are the tips I know would help. Could drop some more tips in the comment section. um, Tell us about what really helps you during crisis. Also, if you're already in crisis, I think there are ways you could actually control it as well. You can take hot baths, use heated pads, keep your friends close. Their friends are good therapy, to help you a lot. And then join support group. And then you can also use distractions. If you're having pain, try and watch something interesting. You could watch a show on the TV. Try and do something that distracts you from the pain. I know there are some severe pains that you could care less, but you could just try. Thank you very much. I've come to the end of today's edition, and I hope this was educative and you were able to gain a lot from this. Next week we'll be talking about complications in sickle cell. Till then, my name is Adebanjo Ebukunje. So see ya next week. Bye.